The expressed views, statements, and opinions by the guests on the Risk Advisor program made either during the show or on the corresponding social media and blog outlets are not necessarily the view or opinions of Baxter Productions, Inc. or any of its affiliates, associates, or others who are part of this production. Information provided during this broadcast is for news purposes only and does not constitute a remedy for any of the discussed risks presented.
Did you ever wonder about over-the-counter medications? Did you ever think, like most people, that since it's over-the-counter, it must be safe? Well, you may be very wrong. What are those risks and what should you consider? Well, that's today's topic on theriskadvisor.com.
The Risk Advisor. You're listening to the Risk Advisor Vodcast. The Risk Advisor highlights topics about the most important personal security and safety issues today. This is for you, your family, and your loved ones. Experts alert to trends, tactics, and techniques used against us. You can be more aware and more informed to stay safe in this ever-changing, complicated place we call life. And now your host, media's go-to guy, Sal Lifrieri.
Welcome to theriskadvisor.com. We're back today again with Dr. Maria Lotempio. Dr. Maria Lotempio is a double board certified surgeon in plastic and reconstructive surgery and head and neck surgery. She was born in Buffalo, New York, and started her medical career first by entering the field as a nurse, working as a neonatal intensive care nurse. Later, she realized her goal to become a surgeon early on and graduated from the State University of New York Buffalo School of Medicine. We are happy to have you back yet again.
Well, it's a pleasure to be here once again. Thank you.
So we want to talk about over-the-counter medications today. They're sold without prescription from healthcare stores all over the place. What are some of the things that we should be worried about? I mean, you can get them without a prescription.
Well, I mean, there are so many types of medications that if you walk into the pharmacies today, you see aisles and aisles of them. And those are a little bit different than walking into, say, of a GNC store and looking at the vitamins. And that's a whole nother topic. So let's first focus more on the pharmacies, the type of medications that we use regularly, such as if we have a headache, stomach ache, things like that. So with a variety of different types of medicines, I think the first thing that consumers need to know is they need to read the directions on the box. They need to understand that one tablet versus two tablets, is crucial for treating whatever they're trying to treat.
Is there a distinction between herbal supplements and over-the-counter, or does that all fall into the same group?
Well, they do. They're just one's categorized as vitamins, where the other ones are categorized as over-the-counter medicines.
So in other countries, there's a regulatory agency that's looking at some of the over-the-counter stuff. What do we have in the United States?
Well, for the over-the-counter medications, we do have a regulatory agency that looks into that and makes sure that the ingredients are tested and they have the risks that have been researched and are available for the consumer to read.
Does that go under the same then as prescriptions? Do we get the same comfort factor that it's been as researched as long and as much?
Yes. The difference really with prescriptions is that there needs a little bit more control in terms of the ingredients, higher ingredients, more side effects, and need to be followed by a physician.
So in the research for this, we was reading that according to active pharmaceutical ingredients rather than their final product. So are they looking at individual elements of what ultimately becomes the final product?
Well, there are several different manufacturers of medications out there, and the pharmacies have the ability to go to different manufacturers for the same drug. That drug has an active ingredient, which is similar across the board, if not the same, but the other ingredients can vary 1 or 2%. So give an example, an individual is on a certain type of medication for blood pressure, and their pharmacy no longer carries the generic form from a specific manufacturer, and they switch manufacturers. And now the individual comes back to their primary care doctor or to whomever and says, my blood pressure seems a little bit higher. I'm not too sure why. I'm still taking the medicine as prescribed. They may be sensitive to that 1 or 2% that may have been different from the previous manufacturer that their drug was made from.
But in over-the-counter medications, if I got this right, the manufacturer can change the formula to the ingredients or the sourcing.
They can.
Without going through regulatory approvals again?
They have to be within a certain percentage point. They have to be within a limit. They just can't just change it. Otherwise, then they're not able to put their medication on the market.
Is that why sometimes we see this product has not been approved by the FDA in some of the advertising that you see?
Yes, but then again, is that a vitamin? Because generally, if it's over the counter or prescription, the Food and Drug Administration has looked into the medication and has looked into the different types of risks, complications, and the benefits that the drug has provided in a research study.
So vitamins are not in the same category?
Correct.
So we have prescription medications, then we have over-the-counter medications, then you have vitamins and whatever else can come down.
So, and that's a little bit of a gray area too, because prescription medications, let's put that in one box, and then over-the-counter, let's take that and break it down. So over-the-counter could be Advil, or it could be vitamin D. One's a vitamin, and one is for a medical ailment, headaches, such and such. The Advil has gone through a regulatory process, but the vitamin has not necessarily gone through a regulatory process. However, though, to make things even more complicated, your physician can prescribe a higher dose prescription-only vitamin D. So now I probably confused everyone here.
He lost me, but that's okay.
Right.
Yeah.
So over-the-counter medications?
So a doctor could actually prescribe a vitamin?
Yes. But it's
that you can't buy in a store?
Yes, it's a higher dose.
Okay.
Okay.
And we're not even touching the compounding of all of that. We're not even getting into
That's for
all
another
of that.
day. That's for another day.
Okay, when we come back, we're going to take a little bit deeper look into all of this, and we'll figure out what some of the further risks are. We'll be right back.
Hi, my name is Dr. Maria Lotempio. I'm a plastic and reconstructive surgeon here in New York City with an office in the Middle East. I always knew I wanted to be a surgeon, even at age 6. But it wasn't until medical school that I knew what area of surgery I wanted to go into, and that was head and neck surgery. The anatomy was challenging, and I enjoyed every aspect of it. But during my residency as a head and neck surgeon, I realized that I also enjoyed the reconstruction and the aesthetics component. From there, I was able to learn how to take care of and perform surgery on all age groups, men, women, and children.
Dr. Lotempio was very knowledgeable in procedure. She told me everything I need to know about aftercare, about the procedure, the expectations, and she was great.
If you're looking for a change, come to our practice. Sit down, have a conversation, and let me see how I can help you.
Welcome back to the Risk Advisor Show. We're here with Dr. Maria Lotempio, a board-certified New York-based plastic surgeon, and we're talking about over-the-counter medications and understanding the possible side effects that they may have. So we left off talking about some of them, but let's talk a little bit about some of the issues that you have with them. And it says rule number 1: don't take them lightly.
Great rule.
Great rule. This is a half-hour show, Doc.
So, I think that, with medications that...
Now we're going to go, yep, nope.
Medications oftentimes, they're so available. They're available at the gas station. They're available at the pharmacy. I mean, they're available in the bodegas, the street vendors. They're everywhere, so to speak. So when people have the impression that their availability is there, that maybe they don't have a dangerous component to them, and that can be scary.
But they do need to be aware of what has acetaminophen, what has ibuprofen.
True. So, again, when you're looking at over-the-counter medicine, you need to pick up the box, the bottle, the packaging, and you actually should follow the directions and look in the ingredients. And those that are getting a little bit older, we need magnifying glasses. And even if you're younger, you're still going to need magnifying glasses because all that information is really printed in the tiniest form on those boxes. But if you open up those boxes, there's oftentimes a very very advanced sheet with everything you possibly could ask and answer on that piece of paper. But very few of us actually do read that.
Very few of us can understand it.
That is true. That is true. But you do need to look at some of the basics. So if you're going to break it down, what do you want to look at? You want to, number one, look at is how often do you take the medication? Medications are done by hours or days. You take it once a day, you can take it twice a day, you can take it every 3 hours, you can take it every 4 hours. That's important. You don't want to go over that time frame, or you don't want to go under that time frame, because in both those scenarios the drug becomes ineffective or becomes more potent and more dangerous. So if a medication says every 4 hours and you're taking it every 2 hours, you're setting yourself up for a complication or risk.
Is it sometimes, though, as the patient, sometimes it gets a little confusing when you're talking to a doctor and you say, I'm going to take a leave for pain in my arm, and I get, all right, well, take 2 right away, and then you can take 2 later, and then you can take, and you look at the bottle and it says, take one at a time.
Right.
So obviously you're going to be guided by the doctor. If I'm having the conversation with the doctor, I'm going to be guided by it. But doesn't that cause some kind of confusion?
Well, it does, but this kind of goes back to why certain things have a prescription, certain things don't. So as a great example, Advil or ibuprofen or Motrin, they're 200 milligram tablets. The recommended dose on the box and the packaging are 2 pills every 6 hours. As a surgeon, I use it for post-op pain. I often will tell patients to take 3 tablets or 4 tablets every 6 hours, which is not recommended on the box. But I am treating a specific problem, and I know, based on my knowledge and my experience, that that is a safe dose for a temporary time frame.
But that's something that the patient shouldn't be deciding on their own. I shouldn't be looking at it saying, gee, I got more pain today, so I'm going to double down.
Great. And I have some patients that will take 4 tablets every 2 hours, and I just look at them and cringe, because that's setting them up for a whole list of complications that they really don't want to experience.
So let's talk a little bit about some of the drug interactions when we're looking at taking over-the-counter medications and how it can affect other medication that you may be taking.
Right.
Right. So one of the things was duplication, about taking 2 medications at the same time and how they go against each other potentially.
Right. So, and this gets, again, a little bit more complicated because we have to understand really the physiology and the breakdown of how medications are absorbed in our system. And then again, this is why you really need to ask your pharmacist or your physician about these questions, because these are actually hard questions to answer without the education. But certain medications that you can take, actually, if you take one with another, it can amplify the effect of the original medication. So in some scenarios, you're basically taking a double dose, a stronger dose, and that stronger dose could potentially cause more complications and risk factors.
One of the things that we talked about during the break was pharmacists being the key gatekeeper.
They are.
And
they are.
Of course, they're the ones that actually know what you're on and what you're taking. Most patients are going to lie to the doctor, right?
They do. And they may not, I don't necessarily like to say lie, but they may not fully disclose everything that they're on, either because they've forgotten, or they feel embarrassed, or it's just not important to them. I don't know. But either way, it's really the pharmacist that should be asked these questions. They're the ones that are educated. They're the ones that have the experience. They know the interactions between these different drugs. They know the complications. They know the risk factors. And very often I will have pharmacists call me and say, hey, You prescribed a medication. Normally we have this dose. You wrote it for that dose. Kind of want to know what your feelings are, why it's an unusual dose. And, most of the time, I do it for a medical reason. And once the pharmacist is like, oh, that makes sense, I understand. But they're actually also checking and making sure that I don't give that individual, potentially, dangerous medication at a dangerous dose, which is their job.
And that's why it's probably also important that you go to the same pharmacy to get your prescriptions filled. I would think that would be something, a risk that you could avoid by going to 2 or 3 different pharmacies.
Well, okay, so yes and no. I mean, if you go to Walgreens or Duane Reade, that's a national pharmacy, or CVS, that has a national database. So your name and your medication list, once it's in a CVS in New York, should be on a CVS in Boston, technically. But if you're going to a CVS and then you're going to the Duane Reade and then you're going to the mom and pop's, drugstore down the block, then that's definitely, you need to be really clear and fully disclose all the medications.
And within the last minute we have for the segment, let's talk about allergic reactions. What are some of the signs and symptoms of things where if you're doing the self-medication, you got a problem?
Right. So we always worry about a couple things. We worry about rashes and then hives and any shortness of breath. If any of those reactions are seen, you stop the medication immediately, and you should actually call or go to your nearest emergency room if you have hives or any kind of shortness of breath. To be safe is that sometimes we offer Benadryl when patients have an allergic reaction. If you have a rash and you possibly don't have breathing disorders, hives, or any other problems, then maybe a little Benadryl can help you. But to be safe, and I recommend everyone who has any kind of reaction to a medication, you call your pharmacy, you call your doctor, you go to an urgent care, you go to the ER. This is not something that you really want to wait and see how it goes. This is not a situation that you want to wait and see how it goes.
Okay, when we come back, we're going to talk about managing those risks, over-the-counter medications. We'll be right back.
Workplace violence, terrorism, identity theft, cyberbullying, and stalking. It's not a matter of if they will happen, it's a matter of when. The security world is too complicated to do it alone. You need a security advisor. Call Protective Countermeasures now. Protective Countermeasures has been providing security consulting to Fortune 500 companies for nearly 20 years. Call today, 914-576-8706, protectivecountermeasures.com.
You're watching The Risk Advisor, and we are back with Dr. Maria Lotempio talking about managed risks through over-the-counter medications. So we've been talking about some of the issues, some of the problems dealing with doctors issuing the medications, patients not following them, all of that together. Let's talk about some of the actual risks and things to avoid. So if you don't understand something about the medicine, talk to your pharmacist. It's funny because most people don't talk to the pharmacist, or at least I don't think most people talk to the pharmacist. If I have a question about medication, I pick up the phone and I call the doctor, or I wait till I see the doctor. Right? I don't use the pharmacist as a source of information. Is that something people should take advantage of?
Oh, absolutely. I mean, they're the wealth of information. I mean, they have more information than we do when we talk about medications, either over the counter, either prescriptions. I mean, they understand every nuance about that medication, interactions, side effects, and definitely you should utilize that knowledge base.
Taking the medication just as the doctor at a fact label said. We've talked about this before, but it's a critical point, right?
It is a critical point. The medicine that you are receiving and putting into your body, again, can have potential complications, which can be dangerous. The way we put instructions on the bottle is for a reason. Not to make your life difficult if we ask you to take a medicine for four times or 5 times a day, but to really adequately treat whatever that problem is.
What about somebody who takes a a length of medication, the prescribed dose. So I got a pain in my arm, I take it, and it says don't take this for, take this for like 4 days, and then all of a sudden the pain continues, and now I decide I'm going to do this again and again and again.
Right. So I think the best advice that I can give consumers out there is, if after a trial period the ailment that you're actually treating has not resolved, then there's something else going on, and that's when your physician needs to step into the picture. You need to make an appointment and go see that individual.
Most people, well, everybody's got a different pain tolerance, right?
That is true.
Some people can just sustain the pain much longer before they actually decide that they're going to do something about it, right? Or they're going to try and self-medicate. Does that ever pose a problem for the physician? If not necessarily that I'm making the problem worse, but if I've been on medications, does anything that I do going into the doctor with something that's been nagging at me for 2, 3 weeks, 4 weeks, whatever, does that cause you a problem and preclude you from being able to diagnose or treat in any way?
There's something called adaptability, where the medication at a regular dose no longer becomes effective, and we have to increase that dose to get that same response. So people that are on prolonged antibiotics, and we're going to use as an example pain, and pain medications is really a whole separate segment in today's world, and I don't want to touch too much on that, but it does give us a little bit of a convoluted picture because we really don't see truly what's going on. If someone is taking a medication for 3 weeks and they only really should be on it for 7 days or 5 days, we have to start thinking, is this medication affecting other systems? Why is the medication not affecting the problem? What is the problem? Are we missing something? So it's difficult to really answer this question in this short segment as we are right now, but the physician has that knowledge and experience to hopefully grapple with these issues.
You mentioned antibiotics, and that's something that people, are somewhat aware of, is that you don't want to keep taking antibiotics because the more you take it, you're building up an immunity to that. Is that being stated right, that you're building up an immunity and they become less effective?
Well, yes, that is true, because I think the problem, though, is that when we get sick, we often think that if we have been given antibiotics in the past, we know it's for a bacterial infection, but not all sicknesses or colds are bacterial. A lot of them are virus, and if you keep taking antibiotics for a viral problem, number one, the antibiotics are not going to affect you at all. You're not going to get better if it's a viral problem. And secondly, you're causing something called resistance. So that, let's say you truly do get a bacterial infection in the future, because you've been on a certain antibiotic, that antibiotic is no longer going to be effective to that bacterial organism. So now the doctor has to figure out what antibiotic will help that organism. So you're basically taking this large pool of medications and making yourself into a small pool with resistance. So ultimately it becomes harder to treat.
We've talked about adults. Let's talk about children briefly.
Yes. So, my best advice to any parent is always ask your pediatrician or your pediatric nurse about medication. Just don't go into a pharmacy and just start randomly giving your kid vitamins over the counter. Call that doctor, run it by the doctor, and make sure that they say, yep, that's fine. Go ask your pharmacist. Ask these questions before you just go in the aisle and you pick something up.
Some people have difficulty swallowing capsules and tablets, so you'll hear of people opening them up there,
right,
putting them into drinks.
The reason we give you in a certain packaging format is because we want it to work. You're opening up the capsules, you're cutting the tablets, you're actually decreasing the efficacy of the medication. You're actually decreasing the ability of that medication to do their job.
How about alcoholic beverages? Is it good to take a shot with my antibiotics?
No, unfortunately not. You shouldn't take any kind of medicine with alcohol. Never take any kind of medications with alcohol. And Juice. I think this is also a big one. Never take any medications with juice. Juice actually causes the medication to be distorted in the stomach, so that medication does not get absorbed. And some medications also with milk. People take medications with milk. So read the label. Don't take it with citrus. Don't take it with dairy products. Don't take it with alcohol.
How about heat? Put it in a hot cup or have it with a hot cup of tea or something.
Same thing.
Hot tea to me is when you're sick.
Yeah.
That's automatic. It's either Chinese food or I'm sick. That's the only two times.
Follow the directions. If you stay within a manufacturer's instructions, you will not go wrong.
Shouldn't go wrong. All right. Well, once again, I'd like to thank you for coming in, for coming back to seeing us. And we'd like to remind you, if you have a question or a comment, you can write us at questions@theriskadvisor.com, or you could follow us on our social media accounts that you could find on our website at theriskadvisor.com. Thanks again for watching, and we hope you tune in next week.
We hope you enjoyed this show. If you have any questions, would like to appear on the program, or recommend a guest, contact us at theriskadvisor.com. Follow us on Facebook, Twitter, Instagram, and LinkedIn. View and listen to us on iTunes, iHeartRadio, YouTube, and Roku TV. Tune in live on various local radio stations. Find links to all of these and listen to past shows at theriskadvisor.com. Thank you for listening. Stay safe and join us again next week for another episode of The Risk Advisor.
From the files of New York detective Frank Santasola, a riveting murder mystery novel, The Garbage Murders. After an illicit liaison with his mistress, the owner of a private sanitation company in New York is murdered. Enter the life of Detective Frank Miranda, one of a few men in law enforcement to infiltrate the Italian mob and bring to justice some of the biggest names in organized crime history. On Amazon Books in paperback and Kindle editions.
TheGarbageMurders.com.
TheRiskAdvisor.com.